Aging is an inevitable process. However, it is how gracefully we handle it and how lucky we are in how well it handles us. Hi, I'm Dr. Rajat Kandhari, Director of Via Aesthetics, and today I'm here to dispel some of the myths associated with the aging process and to discuss how we can build a good anti-aging skincare regimen. So, how does the aging process occur and what are the essential kinds of aging? Well, there are essentially two types of aging. One, the intrinsic aging process, and the second is the extrinsic aging process. The intrinsic aging process, as most of us know, is our chronological age. How our body is biologically aging when we are turning from 20 to 30 to 40, and what changes occur along with it. However, on the other hand, there is something called extrinsic aging, or also known by many as photoaging. This process is governed by various other factors, and these factors include your genetics, they include the sun exposure that you're exposed to, the external stressors such as smoking, alcohol, drug, the stress that you face, and of course automobile smoke, pollution, so on and so forth. Finally, your habits such as how good your diet is, how well you're sleeping, how mentally well aligned your mind and your body is together. All these together in a genetically predisposed individual lead to the aging process. And this is not just with your skin, but with every organ of the body. But because our skin, in fact, is one of the largest organs of our body, it is visible and it is a mirror to your soul, as so many say. So you see most of the aging process more so on your skin than maybe your bones, than maybe your heart or your liver. So it's only pertinent that we take care of it and be consistent with a proper skincare regimen in order to deplete or delete or allay these aging processes. Now, in a genetically predisposed individual, when there's an amalgamation of all these factors, they lead to something called oxidative stress and release of something called free radicals. What do these do? These essentially sort of make holes in your skin, right? They smolder into your skin over a period of time. Imagine the high pollution levels, right? So what do? They have small little particles which find their way into your skin through your bloodstream and start irritating the skin. So what does this lead to? This leads to a depletion of your collagen, your elastin, changes in your DNA all over your body, not just in your skin, decreased immune system of your skin and other body parts, and finally leading to the final phenotype of fine lines, wrinkles, increased pigmentation, depleted tone and texture of your skin, decrease in the glow and brightness of your skin. And this leads to the final aging process. And you see this visibly as you go from your 30s to your 40s and finally your 50s. How is it important that we prevent all this? Now, even though I am a dermatologist, I would wholeheartedly say that a lot depends on how well you take care of the machine that God has given you, which is your body. How well your habits are, how well you're sleeping, how well you're eating, how well your mind is aligned with your bodily state. All this goes a long way in taking care of your skin and your general health. Finally, coming to how do I build an anti-aging skincare regimen? Now, a 30-year-old coming into the clinic sometimes asks me, what is a good time to start the anti-aging process? And how do I start building it? It's daunting because there's so many products out there and so many of them marketing to start early. So we are in an era today where instead of rejuvenation, we talk in fact about rejuvenation. So early starts lead to better outcomes. So it's a good idea to start early. However, what you start in your 30s or 40s may be very well different than what you're going to be using after your 50 years of age. So certain common ingredients which we all use and hear about are, number one, retinol. Retinol is probably one of the anti-aging ingredients which has been most talked about and has the most evidence supporting its use. It leads to an enhanced collagen production by stimulating your fibroblasts and increased skin thickness, decrease in fine lines and wrinkles, decrease in open pores, improved texture, and in fact even decreased pigmentation. So it's a win-win. The problem with retinol is only one. So if you're starting, let's say in your 30s, you want to use a precursor of retinol which is much more easier to apply, a starting retinol or something like a retinaldehyde. This is easier to apply particularly for people with sensitive skin, and it goes a long way in building your retinol regimen. When you go from your 40s to your 50s, you want to maybe graduate to something which is 0.05% retinol or 0.1% retinol. And finally, when you reach your 50 age or above, you want to probably increase the concentration of your retinol or graduate to a prescription retinoid, also known as tretinoin. Mind you, please talk to your dermatologist before using any of these products because each skin is different and plan is made as per your skin. Number 2, AHAs or alpha hydroxy acids. Again, a lot of evidence supporting their use, again leading to increased skin thickness, and in fact they even decrease an enzyme called tyrosinase indirectly. So what they do is they decrease pigmentation, also exfoliating the dead cells on the top of your skin, leading to a brighter effect, improved texture and tone, and by indirectly affecting this enzyme they decrease the melanogenic process, so decreased production of melanin. In your 20s, 30s, 40s, 30s to 40s, it's a good idea to start with AHAs. It's a good product, fairly well tolerated, and if you cannot tolerate an AHA, there are certain things called polyhydroxy acids, the younger brothers of AHAs, which one may want to start using. AHAs may be started as 4 to 6% and slightly graduated up as you keep on tolerating them. These are present in face washes, in creams, in serums, in lotions, you name it. So it's a good idea to start with these. However, when you're combining a retinol and an AHA, please be mindful they are both exfoliating agents, so you want to go slow. Again, consult your dermatologist before taking this call. So it might be a good idea to start with one, let your skin tolerate it, and then go to the next, or start them on alternate nights is a good idea. Number 3, antioxidants. Antioxidants, the most common one that we are all aware of is vitamin C. You said it. So what about vitamin C? What should we know? There are numerous forms available again. So most commonly accepted form is L-ascorbic acid. Now there are many other forms such as ethyl ascorbic acid, ascorbyl glucoside, which tend to have a decent penetration into the skin and conversion into L-ascorbic acid. But L-ascorbic acid is essentially the main one. It should be at least 10 to 20%. Starting off with the 10% is a good idea because 15 to 20% becomes fairly aggressive. Start with 10%, and when you're using a vitamin C serum, please make sure you use minimal amounts to start with. Serums are concentrated products, so maybe 1 to 3 drops to start with is a good idea. Doing 2 to 3 drops all over the face can lead to you coming into my clinic and telling me you've got acne. So start slow. It's a good idea to start in the day and use a broad spectrum sunscreen with it. Vitamin C can be applied in the day or in the night or both. So it's a good product to start with, and it's a good idea for anyone in their 30s and 40s to start with this as their anti-aging skincare regimen. Number 4, peptides. Now peptides are easy products to use essentially, and what do? They are signaling peptides. They signal your skin cells or trigger them to start doing stuff, to start making collagen, to increase or decrease pigmentation, and so on and so forth. They can be used at any age group as an add-on therapy, right? So just to break things, just to decrease the exfoliation as well. They are mostly available in serum forms or moisturizing bases. So it's a good idea for a 30 to 40-year-old to maybe start with the peptides, and a great idea for a 50-year-old to use a hydrating peptide as well. So these are some of the ingredients which can help. And number 5, maybe certain supplements such as collagen, such as beta carotene, such as good antioxidants which can orally be taken, such as astaxanthin, which can to some extent help the aging process as an external supplementation, a protein source, or something which delays the free radical damage. So as I said, 30s to 40s, 40s to 50s, and 50 and above, slightly different skincare. Graduate with it as you go on. Now, other than just the skincare that you're doing at home, there comes a time wherein you might feel that this is not enough for me. It's not just working out enough. I still see some of those lines. I still see the hollows under my eyes. I feel my skin is sagging. So this is the time when you want to again visit your dermatologist and ask for other options. And it's a good idea to start early. So again, if someone's in the 30 to 40 age group, it's a good idea to start with simple procedures like skin boosters, platelet-rich plasma, or something as simple as a laser toning process or a laser genesis process. This helps in slight firming, overall skin health, and brightening of your skin. When you go from 40 to 50 years of age, you can go on to collagen induction therapies like a derma roller, a derma pen, a microneedling therapy. This helps in stimulating collagen. And if you're spending your money and using your time, it's good to start with something which will last you much longer. And when you go from 50 and above, high intensity focused ultrasound is a good option. It helps in lifting of the face, maybe graduating to certain injectables which you may require. Other than all this, of course, an overall good care of your body, as I said previously in the video. Good sleep, 7 to 8 hours a day, good nutrition, good mental health. All this goes a long way as an amalgamation in wholeheartedly giving you a delay in the aging process. If you like this content, please give us a thumbs up and follow us for more content.